how do we avoid fungal infections? So here are a few tips. So hi guys, welcome back to my channel, and as you can see today I'm on my work attire. Yes, I'm a clinician by profession, so today I decided to share a few tips with us ladies. So okay, we are going to talk about vaginal candidiasis, as you have seen, also known as vaginal fungal infection. Yes, so one thing, I'll start by telling you, how do you know that you have vaginal infection or vaginal yeast infection? So one thing is itchy vulva, or you have itchiness on the vulva or vulval region, stroke the labia area. You feel that there is itchiness or burning sensation. The second thing is that you may notice a whitish discharge that is curd-like. Kwa Kenya, we call it like maziwa mala or something like yogurt. Yes, the discharge, sometimes it's a lot, but whitish, and it can have some smell. The other thing is itchiness down there, as I've said. You might experience some itchiness on your daily routine. When you just see it, you feel like itching yourself. The other thing is painful coitus. Painful coitus is pain while you're having sex. You might have experienced some pain. Then you also have painful micturition, that is pain while urinating. Yes, so those are a few signs that will tell you you have vaginal yeast infection. So here are a few things that may lead to you getting candidiasis or fungal candidiasis. So one thing is prolonged use of antibiotics. Yes, prolonged use of antibiotics may lead to recurrent or untreatable vaginal candidiasis. The other thing is the increase in the estrogen level. So that happens mostly in pregnancy. When someone is pregnant, you tend to have the estrogen levels tend to be high. So yeah, someone may experience the recurrent candidiasis. That's not your fault. It's the hormones playing themselves. Then sometimes it's the stage from puberty to menopause. The hormones tend to be imbalanced. Also, you can lead to recurrent, or it can lead to vaginal candidiasis. The other thing is you are using the oral family planning method, that is the pills, because most of them have estrogen also, so they tend to imbalance your pH, and you might be experiencing the on and off or the recurrent vaginal candidiasis. So if there's a way you can avoid, well and good. So also avoid using the antiseptic wipes. Use clean or just water-based. Any scented antiseptic wipes are not good for down there. They're not good for you. Just avoid that. Then when you're cleaning, just use water, clean water in your hands. Yes, you don't need to avoid dodging. Those of you who do dodging, please don't do that. We also have a lot of things, that herbs and things that they sell, saying that it will keep your vagina fresh, or just avoid those things. They are not helping, they're just worsening the situation. So guys, here I'll share a few tips on how we can avoid the fungal infections or the vaginal candidiasis. So one thing is avoid wearing very tight clothing or trousers. Let them have enough aeration or be a bit loose. 2, let's wear cotton panties, because cotton helps absorb the discharges and everything, but now when you wear the nylon and everything else, they tend to keep the moisture there, and yes, you have high chances of getting the infection. 3, let's wipe from front to back. Ladies, front to back, not back to front, because yes, we tend to transfer a lot of the bacterial microbes when we wipe from back to front. So while cleaning ourselves, while washing ourselves, let's learn to do it from front to the back. That's the other thing. Then avoid the abuse of antibiotics. Don't just go over the counter buying antibiotics unless you're sick or something else. Don't avoid buying of the counter antibiotics and misusing them, because they also tend to alter the pH, and yes, when the pH is altered, you tend to be more vulnerable to being infected or having the candidiasis. Yeah, so someone will be asking, how do we treat the vaginal candidiasis or the vaginal fungal infection? So it can be treated by over-the-counter drugs, but I'm not saying just go over-the-counter and buy the medications. Listen to me first. They can be treated by over-the-counter oral antifungal medication, that is fluconazole. You can take a dose, that is 1 tablet once. We also have a cream, that is clotrimazole cream. You can either apply on the area where you have itchiness, or you can either also insert the tube and you press it, like you apply it inside. You can use your finger, very clean finger, then you apply the cream inside. We also have the clotrimazole pessaries, which are inserted. So 2 to 3 days. We have the dose for 1 day, 3 days, and 6 days at night. Yeah, that will help. And if you're pregnant, please don't use oral antifungal medication. You can use the topical or the pessaries, but the best way to go about it is seek medical advice. Just go to your doctor, explain to your doctor that these are the signs that I'm experiencing, and yes, they'll advise you accordingly. And in case you've been treating fungal infection for a long time without any improvement, or maybe you've taken the dose for maybe it's the tablet for a day, or you've used the pessaries or the cream for like 3 to 5 days without any improvement, then I'll advise you to seek medical attention for proper investigation. We have something called the high vaginal swab, where they swab and do the test, then you'll be given medications according to your results. Please, if you have recurrent infection, don't try to treat them at home. Just go to the hospital and they'll help you out.